Hello, I'm Heather Krasna, Associate Dean of Career and Professional Development and Adjunct Assistant Professor at Columbia University Mailman School of Public Health. And today I'll be talking about our article in AJPH, Standard Occupational Classification Codes, Gaps in Federal Data on the Public Health Workforce. I want to acknowledge that this project was part of the Consortium for Workforce Research in Public Health, CWRF, and it's supported by the CDC as well as HRSA. And we also acknowledge the de Beaumont Foundation and Association of State and Territorial Health Officials, which collaborated in this project with the Public Health Workforce Interest and Needs Survey data. Now I will start out by explaining what it is that we mean by a workforce taxonomy. So when we think about different job functions or occupations in any sector or industry, it's helpful in order to research what kind of jobs exist, for example, in public health organizations, by looking at the different job functions or otherwise called occupations. And so in an ideal world, we would be able to use federal data to find out, for example, how many epidemiologists there are in the United States. And the Bureau of Labor Statistics, which is part of the US Department of Labor, does have a large amount of data on very clearly described occupations. And we are lucky that, for example, epidemiologists is very well defined and described in the Federal Occupational Classification Codes, which is what the US Department of Labor uses and many other federal agencies use when conducting research on different occupations. This could also include enumeration. How many people are epidemiologists? It could include salary information. How much do they get paid? What industries hire epidemiologists? And it can even include occupational exposures for workplace health and safety issues. So for example, here's what an ideal situation might be if we are using federal data to research the public health workforce, is that we would have occupations clearly defined in our federal occupational taxonomy. Then we would also want to know how many epidemiologists, for example, work in health departments. And that is a different kind of categorization, which is called the North American Industry Classification System. And so this is basically a coding schema that is used by many federal agencies to classify the location of the work being done. Who is the employer? Is it a pharmaceutical company? Is it a local government agency? Is it a hospital, for example? So there's a code for many, many, many different industries. And there is actually a code for administration of public health programs. So in the ideal world, we would be able to use federal government data from the US Department of Labor or maybe Census Bureau, other federal agencies, to answer a simple question like how many epidemiologists work in local, state, tribal, or territorial health departments. It would be even nicer if we could use federal data to say how many epidemiologists work in state health departments or how many work in local health departments. So this would be what we ideally would want to be able to have for federal data. But unfortunately, we don't really have clear enough data on two different levels. First, the occupations are not always clearly delineated in the federal standard occupational classification codes for every occupation. And the data is not always gathered according to the sector in a way that would help us use that data for things like enumerating public health workforce in local government or in state government. So as just an example, here's an occupation, disease intervention specialists who work in health departments. From the research I'm about to show you, we found that they do not have a standard occupational classification code. So that means the federal government would not have any way of telling us how many people are disease intervention specialists. Secondly, the data on where these folks work is also lacking. So there is the Occupational Employment and Wage Survey that the Bureau of Labor Statistics uses, which could tell us data on how many, for example, epidemiologists work in state government or in local government, but that survey does not use the public health industry code. Unfortunately, they just use local government, excluding schools and hospitals, And then they have a second code for state government, excluding schools and hospitals. Now, you might say, well, maybe we could still use federal data to make an estimate of how many epidemiologists work in local government, and that would give us a fairly good estimate of how many epidemiologists work in, let's say, local health departments. Where things get much messier is that there's many occupations existing within local or state government health departments, which might also work in many other local government agencies. Just as an example, social workers. There are social workers who work in the health department, but there's also social workers that work in schools, in local schools, which might be, we mentioned excluding schools, but you can imagine also, for instance, a human services department within a city government, for example, or Department of the Aging, any number of other departments where you might have a social worker. So we would not be able to use the Federal Bureau of Labor Statistics data to find out how many social workers work in local health departments. This gets even messier when we look at many other occupations that really are hired across different government agencies. Maybe nutritionists is another example. Nurses is also an example. So you can see that the data that we have really cannot answer, the federal data cannot answer some questions about how many people work in local or state health departments and what do they actually do. So this is just not available because many occupations don't really have a clear standard occupational classification code. And then we're also not using the right industry codes to get fine-tuned enough data. So our question was, which public health job titles clearly match to a standard occupational classification code, and where might there be gaps between these codes and the occupations that exist in health departments? To try to answer this question, we first started by looking at previous attempts to create a taxonomy and ideally to match it with standard occupational classification codes. So one of the challenges of research in the public health workforce is, for example, we know that we can get data that is gathered through efforts like the Public Health Workforce Interests and Needs Survey, PHWINS, which is fielded by the de Beaumont Foundation. There's also data gathered by associations like the National Association of County City Health Officials, NACCHO, Association of State and Territorial Health Officials, ASTHO. They are all gathering very important data, but sometimes the categories for workers does not necessarily clearly match up with the federal data. So we started out by looking at prior attempts to build a taxonomy and how those might match with the standard occupational classification codes. The second step, which is sort of the heart of this study, is that we actually were able to access data from the Public Health Workforce Interests and Needs Survey instrument, and we were able to get the actual job titles of the recipients of the survey, which included those who responded as well as non-responders. So we focused on those individuals who responded to the PHWINS survey and who also had a job title, which is basically the job title of their position in their local or state health department. When individuals answer the PHWINS survey, there is a question in the survey, which is basically called job category. So what we were looking for is, what is the person's job, their actual job title? What category did that person say they worked in when answering PHWINS? And then do those job titles match to SOC codes? So we're trying to see if the matches for SOC codes were consistent, or were they inconsistent, or were they unable to match? So we started out, again, using these job titles. We had to do a ton of data cleaning because there were a lot of titles that had strings of numbers or letters and a lot of mess. So we spent a long time cleaning the job title data. And then we ran it through a coding system, which is using machine learning to match job titles with standard occupational classification codes. This is called, it's from NIOSH. And so it's this NIOX Industry on Occupation Computerized Coding System. There are a few other code matching tools that are available. This is the one that we selected. It's in alignment with other types of data. So when looking at each of these, we were able to identify the most common SOC codes for each of the PHWINS job categories. And we could see that for many of these PHWINS job categories, the coding system was confused. It came up with insufficient information. And then we also looked at basically validating these codes using a mechanism of reviewing the titles and using expert knowledge of what these job functions might entail and what the job titles tend to mean in health departments to see, using that review, of whether the coding tool had actually been accurate enough. And so we had this ROC code analysis and removed any of the code matches that were under a certain threshold of accuracy. And then we were able to use this data to identify which of these job categories from PHWINS were not a clear match with any particular SOC code. When is it that they might have matched primarily with this result of insufficient information or a lower probability of an accurate match? We also use something called the Herfindahl-Hirschman Index, HHI for short, which shows how much diversity there is within a set of data. And so how many potential different SOC codes were identified that might match with a specific PHWINS job title. And so the lower index indicates that there's less consistency and more diversity in the matching. So those are the types of PHWINS titles that did not clearly line up with a SOC code. Looking at that, the results we found is that there are several occupations that exist in health departments that have very nice, clear standard occupational classification codes. Like I mentioned, epidemiologist is a nice, clear code. Most of the time when someone's job title included words like epidemiologist, and there were several other words that lined up, they were quickly, correctly matched with the SOC code for epidemiologist. Same with health educator. The clinical titles were very easy to match. The SOC code matcher had no problem figuring out if you are a dentist, oral hygienist, et cetera. These were the type of things. Certain other titles matched pretty well. Public health lab titles matched well. It's the title used in PHWINS job category was like public health laboratorian or laboratory scientist. And these matched up with several different SOC codes, but they were fairly consistent, and they may not have been exactly what we would have expected, but they matched with things like microbiologist and things of that nature. There were several where there were just no matches. Clearly, there's not a SOC code for disease intervention specialist. That title, which also included contact tracer and infectious disease specialist, a number of other titles that add up to disease intervention specialist, they just were not able to match that with any specific codes. Policy analyst, you would think would have a solid, clear standard occupational classification code because this is a really common job title across government. It did not match well with SOC codes. Many of the leadership titles, management titles, they all ended up matching to a very broad and generic SOC code that doesn't help you identify people who work in public health, for example. So many different titles all ended up matching to basically managers, all other, which is sort of what I'd call it sort of the potpourri, or even I would call it the garbage can SOC code. This is a code for like people who manage things in an organization, and you can't find a more specific place to put them in a SOC code. So you throw them into this kind of garbage can, I would say, or potpourri, where you're just throwing whatever you can't match clearly, you throw it into managers, all other. Now, there are some that matched very clearly, but I would disagree with the match, and that includes public health nurse. Public health nurse, community health nurse, all matched very, very well with registered nurse, but we can show in other research that the job functions of a public health nurse are distinct and different enough that they don't really look very much directly the same as registered nurse, which tends to be very, very clinical. And so, yes, it matched in the SOC codes, but you could argue that's still not a good and clear match. Several other titles didn't match very well. Peer counselor didn't match very well. There's a number of different titles in health departments that are in this category of sort of peer counselor and so forth. The vital records did not match very well. Now, some of the reasons things didn't match is that actually the titles or job title categories in PHWINS themselves were sort of unclear for certain categories. So there were some categories that it made sense that it just wouldn't match. So this is an example of a table from the article, and you can see that this disease intervention specialist or contact tracer, many of the matches were excluded as incorrect, and many of them were insufficient. The matching tool couldn't figure them out. And it had this low HHI, meaning there were many different titles that the coding tool wanted to match. And you could see that the most common match was insufficient information, and that the titles that matched with that just didn't come up with anything. The second most common match was epidemiologists, and the third was health education specialists. And then there were many matches for social workers, which is probably because the job title includes things like case investigator, case worker, even though that person chose to select that their job is disease intervention specialist. So some of the difficulty in matching is because some of the job titles people have in local or state government tend to be kind of vague, and they don't get very clearly matched with SOC codes because the titles themselves are vague. But still, you could see certain patterns of titles that just didn't clearly match. From this, our conclusion really is that there are several SOC codes that deserve a new code in order to improve the collection of data about the local and state governmental public health workforce. This is a really important issue because right now we don't have a very straightforward, easy way of using federal data to answer some pretty important, pretty basic questions that would help us prepare for future pandemics and emergencies. So we can't really answer questions like, how many people manage programs in local health departments? How many epidemiologists do we have? How many public health nurses do we have? Very hard to answer many of these questions because the Bureau of Labor Statistics data isn't so clear. The occupation codes are not clear. There's also that issue I mentioned about not being clear enough on the industries when gathering data. So future studies, there is another publication which also came out in AJPH, which looks at salary disparities. Again, remembering that the codes are not so accurate or clear all the time, you still can use some of that data to look at salary disparities by occupations and to determine whether certain occupations are paid more, for example, in local government versus other industries. And there's a future study looking at job postings and also alternative data sources to determine if it's consistent with the federal data. Thank you everyone for coming to this presentation, and I hope that this data and this research will be helpful for public health workforce researchers in the future. And if anyone has any questions, feel free to reach out to me, and I'd be glad to discuss further about how this data might be helpful and how we can move forward in improving federal data for public health workforce research, occupational research, enumeration, and salary research, and a number of other topics where federal data and occupational data can be used to improve our understanding of our crucial public health workforce. Thank you so much.